So I was reading this article the other day in the Huffington Post that said something about how senators in America, how the American government is debating over Obamacare and over what possible changes that they have to make, or what changes are viable, or what they have to do, or what they can't do because of money. And it's like there's this battle going on about Obamacare because it's clearly not working, but at the same time, there's not much money available to make changes that are actually effective for the public, and to make sure that public health care is actually health care that it actually takes care of the health of the public properly. So the reason why I wanted to bring this up and bring this into discussion is because I considered an interesting point when I read this article, is that it's fascinating to me that there's all these basically rich people that are in the government, whom I would define to be rich and wealthy because they do have a very decent salary in most countries, if not all countries in the world. The people who are in government positions have proper health care and have basically the money that they need to pay for private health care. So why is it that these people who are basically not involved in public health care at all, in terms of they're not using it because they have the money to go to private hospitals and to pay for private health care, to give themselves the best that they can possibly get, and their children, why is it, or how is it that we believe somehow that these people are capable of making decisions that will be best for us as being the public, as being the ones that will eventually make use of public health care? Why is it that it's not the ones, for instance, who need public health care, the ones who are completely dependent on public health care? Like, you have so many people falling ill every day and who don't have the money to go to a private institution, who don't have the funds to pay for private doctors and consultations and treatments, and to give themselves basically the best that their body needs, the best of what is available. They have to resort to public healthcare systems. And, especially people, for instance, who are suffering from the consequences of defects in the public healthcare system. People who, for instance, have to wait so long that they never even get a turn, and that when the doctor is ready to see them finally, then, it's progressed to such an extent that it's like too late for them. Like, if only the doctor had seen them earlier, if only the hospital had more funds, they could have had that transplant, or they could have enjoyed some kind of treatment that their body desperately needed, and they could have pulled through and they could have survived. But instead, they either lost a limb or an internal organ, or they're gonna be in a specific condition for the rest of their lives, simply because of the healthcare system not being the optimal, functioning to its optimum potential because of money, and because the people who are deciding on how the public healthcare system is operating don't really care enough about the public healthcare system to really make decisions that will ensure that the public healthcare system is the absolute best. It just makes sense if we have a look at our own mind and how our own mind works in relation to other people, in relation to things that are not immediately relevant to our own lives, then we can actually, if we're honest with ourselves, we can see that, you know, we don't really care about other people, or we don't really care much or are much interested in or concerned about things in this world and reality that don't immediately have an impact on our own lives specifically. I mean, there are so many things in this world that we should be concerned about, or that should receive attention, like poverty, like starvation, like you know, like there is so much suffering in this world going on in various ways. But the reason why it's not getting enough attention, or the attention that it requires for it to actually be solved and be changed, is because we actually simply don't care enough. Because what we care about is our own life, and which includes, for instance, our own personal health, the health of our family, of our children, the education of our children, our own personal enjoyment. And after all of that, after our own personal survival and that of our family, after that comes the rest of the world. But I mean, for most of the time, we're only preoccupied in our mind with our own life. And you know, these people who are in the government, they have their own families, they have their own children, their own life. You know, when they go home after they did their governmental job during the day, and they go back home, you know, basically they won't think about what is best for everyone in the country. They'll think about their family, they'll think about their children, and I mean, even while they're performing their job, they will be thinking about their children, and their thoughts will be going more to what they're going to do when they get back home, or, you know, stuff that they're actually personally interested in. Maybe their hobbies, stuff like that. What they're going to spend their money on. I mean, it's what we do when we go out and we do our job. All we really care about is the money that we will receive in our bank account as our reward for having done our job. We don't really care much about the job in itself. I mean, we'll do a good job and we'll function according to what is required of us to deliver a good performance in our job, to receive the money. But I mean, in terms of really caring and giving ourselves and all of who we are to our job, and placing our main focus to only our job, it's simply not what happens, because within each human being's mind, what comes first is personal survival. That is simply how the human mind works. So, I mean, again, returning to the point that I started with, is that to have a well-functioning healthcare system, public healthcare system, obviously the ones who are supposed to be deciding on, making decisions about how it is supposed to be structured and functioning, and what funds are supposed to be going to it, and how they are supposed to be used. Those decisions should be made by the ones who are most involved in their daily lives with the actual public healthcare system, which is, you know, sick people. I mean, people who use the public healthcare system, people who desperately need the public healthcare system, people who are suffering the consequences of how the public healthcare system works and functions every day of their lives. Those are the people who know what it's like to be a victim of a healthcare system that isn't properly designed, and that is designed by people who didn't really care enough. Those are the people who know what it's like to be in that position, and those are the people who will make decisions based on the realization that no one on earth ever should ever experience what they are experiencing. No one should ever find themselves in their shoes. No one should ever lose a child because the healthcare system didn't care enough, because the doctors were too busy, because the medication was too expensive, or specialists weren't available because they didn't have the money, or whatever. I mean, no one should lose a leg because they had to wait too long in the doctor's office, or because there simply wasn't enough money to pay for a complicated procedure that would heal the leg, and they rather had to remove the leg because it was the least expensive option. For instance, there's so many people in this world who know what it's like to be in a position like that, to be a victim of the healthcare system, of a badly functioning healthcare system. And those are the people who will make decisions that are best for all of us, because they know what it's like to be in that position, and they know that no one should ever find themselves in a position like that, and they know that the decisions that they make to change the healthcare system will affect not only them in their lives, but everyone else. So they know that the decisions they make will affect them directly, which means that they will make decisions that are best for everyone, because the decisions are best for themselves. Whereas if you have these governmental officials who aren't really involved or aren't really making use of the public healthcare system, the decisions that they make are not going to be based on this realization of, everyone should get the best possible care. Their decisions will be based on money, will be based on their personal, their own personal ideas that they have, or their own personal value systems where they have been conditioned to, place money first and to be very sparesome with money. And, their decisions will be based on, for instance, receiving validation from the boss. So by, for instance, not spending too much money on public health care, so that their boss will be happy because, because they didn't spend too much money. I mean, but those decisions are obviously not what is best for the public. Those decisions is what is best for the person making the decisions, who is only really thinking about their own job and their own survival. So, this is an interesting point that I was thinking about and that came into my head. That is a fascinating point to look at if we want to ever design a system and a world that actually functions to its optimal potential and that actually exists in a way that is best for all of us, is to look at that point of placing people in positions of making these big decisions that will influence all of us, where we make sure that the people making those decisions are actually people who know what it's like to suffer consequences of a badly designed system, people who will in fact make decisions that are best for all of us, because the decisions that they make will affect them personally, on a personal basis. People who are immediately involved within the results of the decisions that they make. So that's my input for today in relation to a system, or creating a system, supporting a system that would be best for everyone on Earth, best for me, best for you, best for all of us. For instance, a living income guaranteed, which is a system that would provide a living income for each person, for each individual, so that we can all live a decent life. If you're interested in investigating this system, go to livingincome.me, and Go to Facebook and follow on Twitter. I will place all the relevant links under the vlog here. Thanks.